Continuous professional development. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. It's not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local unique situation. The course objectives. After the student's done with this section, you'll be able to understand the importance of continual professional development. You'll be able to understand and verbalize the updated standards and why it's so important to keep up with those advances, the different ways you can directly participate in research and collaboration to help improve the knowledge that's out there, and you'll be able to verbalize the ARDMS certification options that will help to improve that professional development. So this topic is really important because as professionals, particularly midwives, nurse practitioners, obstetricians, we have the ability to advance our skills above and beyond our core competencies. Whenever you're doing an advanced practice skill, you need to have certain certifications, competency checklists, quality measures in place, because if there is ever a question for safety, there's ever a question on a legal stance, you have to be able to defend yourself that yes, I did the proper training, sign-offs, competencies, quality measures, annual, biannual reviews to show you that I'm keeping up to the highest standards of care. It also has a lot of advances for career. It can allow you to get more compensated, especially if it's a low resource facility and it's vital that they have someone that's already trained as a practitioner that can confidently do ultrasound services at the bedside. It will allow you to go above and beyond options for pay, for specialization, for leadership roles. You could be the mentor that's training other people in ultrasounds based on your experience and standards. So you really want to be able to look at how these professional development opportunities affect your practice directly, the community you're serving, and how can you improve the skills to better take care of the patients in the area. So you want to be able to provide always learning opportunities. Right now we're talking about point-of-care ultrasound services and being able to safely know what we're identifying. I think too many times as midwives and practitioners across the country, there aren't formal trainings. You're not taught in school, and then they tell you you'll learn it on your orientation, and then it's rarely done in orientation, and you end up doing self-teaching, and it may or may not be right. You grab the ultrasound machine and you practice on your patients, and you're anxious and they're anxious. There's not usually a designated calm, safe environment to be able to practice and improve your skills. It's the blind leading the blind. You rarely can grab another practitioner to say, hey, am I doing this right? Am I looking at things? You're just kind of holding the machine, holding things, standing, hoping you're getting the image right, just kind of going all over the place because nobody is really teaching us the formal process on a large scale. So that's the whole point of ultrasound trainings, the workshops, these events, because we're teaching you ergonomics, we're teaching you how to hold the probe, we're teaching you how to improve the images, we're teaching you how to confidently get the calibrations in the right place, to get the calculations accurate so you know exactly what you're getting, and that's exactly their due date, that's exactly that fluid level. You're able to recognize anomalies. I think there's too many times that we don't have that proper collaboration partnership with our colleagues to be able to get a formal training. And so that's the whole point of this, and bringing it back to your own practices so that you can make a higher standards of point of care ultrasound trainings. So you want to keep abreast with the technology advances. This is what's hard. I was reading a statistic just a few days ago that when we become out of school every year and a half, our standards and skills that we know on any of our care clinical models is out of date already. And especially technology is going to continue to make faster and faster. The ultrasound machines are changing, the quality of them, the contrast, the the readings, the hertz, the diagnostic capabilities are constantly changing, and every machine is different. So you may have a brand new state-of-the-art machine, but the average midwife, the average hospital has an old, outdated machine, and it's a little clunky, it's a little off, and so you have to be able to keep up with your standards, keep up with the machines, keep up with keeping it clean. Who's maintaining it? Who's monitoring it? So then when you want to grab it next time to use in the clinic or in the triage setting, it's going to be working the highest caliber for you. You want to be able to participate in research. I think too many times we as midwives and nurse practitioners bring so much value to the decision making, the quality improvement opportunities, but we're not part of the data. We're just lumped with the physicians. And I think there's so much that we could bring of our direct outcomes and our direct opportunities with point of care ultrasounds and really evaluating, is this the appropriate scope of practice? Is it too much? Is it too little? What are the risks and benefits of XYZ being part of point of care ultrasounds? Is it improving outcomes? How much skills does each practitioner have, and is that impacting the quality and the views and the near misses and the complications because of that lack of training, because of that not adequate quality measures in place? These are really important things that I would love to see more and more. So the ARDMS certification option at this point is only for nurse midwives. There's nothing for certified midwives, certified professional midwives, nurse practitioners, physicians. There are different specialties. You can get an ARDMS certification in obstetrics, but it's mostly for ultrasound techs. It's not so much for healthcare providers. Only at this point there's a nurse midwife ultrasound certification. I know they're working on more expansions for particularly healthcare providers, but definitely you could be involved in that. You could be on committees. You could help to improve these so we can get standards higher for all aspects. I would love, love, love to see women's health nurse practitioners, family nurse practitioners, physician's assistants actually having a certification that you have to get and follow. I mean, even physicians, a lot of times it could be good or bad how they're trained and the standards that they're doing with ultrasounds, that I would love to see a seal, a certification. Just like we do electronic fetal monitoring, physicians have to get it just like the nurses and the nurse practitioners and the midwives. So I would love to see a transition where ARDMS is setting that same standard. You get this seal, this stamp, so that we know you're meeting a certain benchmark. So these are just some common types of certifications available with ARDMS, but especially with us being um, midwives, I want to primarily focus our energy. And there's a whole nother section that we go over the ARDMS midwife certification process. So I just want to keep high level about why professional development, particularly in point of care ultrasounds, is so, so important. Obviously, we all know it improves outcomes. It gives us a benchmark of what everybody is meeting for knowledge and quality and standards. It'll help improve your career. It can improve the outcomes, the accreditation standards. There's some facilities where you have to have the ARDMS certification in order to do a point of care ultrasound as a midwife. So you have to keep up with the trends, the standards. I encourage all of you to be actively involved in the research opportunities so that we can improve point of care ultrasounds, make them easier accessible, especially around the world. The more research, the more value put into it. They're getting so many amazing opportunities to do Wi-Fi capability and have in these low-level resource settings point of care ultrasounds, but we've got to be able to have education and standards available so that they have a benchmark training to go to.